Do you have fibroids? Do you want to maintain your uterus? Well, today we're going to talk about myomectomy, and that's the surgery that removes fibroids so that you don't have to have a hysterectomy. If that sounds good to you? Continue watching. Well, welcome back to my channel. I'm Dr. DuPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women to improve their lives, and I believe that begins with great health. Well, I've done several videos on fibroids and abnormal bleeding. Today I'm going to talk about myomectomy. I've seen several patients in the office over the past several months that have multiple fibroids, and they're at different stages of their childbearing period. Well, typically for women who want to keep their uterus, one option, and there's many options, but one of the option is to do what's called a myomectomy. And today we're going to talk about myomectomy. Now, there are also some non-surgery treatments that can affect fibroids. And so please look at my videos on fibroids. I also wrote a great ebook on uterine fibroids. It's a very comprehensive guide so that you kind of know what are the treatment options, so that if you're trying to decide which one is best for you, that resource will help you tremendously. Well, in terms of a myomectomy, that just means we're going to remove the fibroids. So fibroids are also called leiomyoma, and depending on the location of the fibroids will depend on how we remove them. And there's many different ways. So there's a FIGO classification system for fibroids that kind of numbers the fibroids. And so depending on their location will depend on the number that they've been given. So for fibroids that are 0 to 1, those are submucosal fibroids. So those are fibroids that usually are in the cavity of the uterus. Fibroids that are 2 through 5 are intramural fibroids. And so intramural just means, intra means inner. So in the wall or in the muscle of the uterus. So those are intramural fibroids. And then you have fibroids that are type 6 and 7, which are subserosal fibroids. And those are usually underneath the lining. And so again, knowing where they are will help us determine how to remove them. And then also there's a type 8 fibroids that are other categories. So those can be cervical fibroids, parasitic fibroids. Like when I had my first surgery for fibroids, I had them in the broad ligament, which is outside of the uterus. So you can have them in many different locations. So the type 8 will be kind of others in different locations. So for women that have a 0 or type 1 fibroids, those can be removed most of the time just with the hysteroscope. So like we, do a hysteroscopy with the dilation curettage for like abnormal bleeding or to remove polyps, or for miscarriages, you can also do a hysteroscopy to remove fibroids. But those are only for the type 0, type 1 that are pretty much contained within the uterus. So for fibroids that are in the intramural, those can be removed usually with a laparoscope or an open surgery. So if we do an open myomectomy, which is what I've had twice, the doctor will make an incision and then carefully remove the fibroids from the uterus. And so that can be done robotically or can be done open. Now, which technique is done will depend on the location, depends on the size of the fibroids, and also depends on the surgeon's skill. So those are very important reasons. And then also depends on how many. If you have 50 fibroids, I doubt it'll be able to be done laparoscopically or robotically. So just keep in mind that not all approaches are available depending upon the size and location of your fibroids. And then also if you have like a pedunculated fibroid or any of the type 8 classification fibroids where it's in the cervix or if it's in the broad ligament like mine was, those typically may be through an open incision. Sometimes cervical fibroids can be removed vaginally. It just depends on where it is. Typically, we don't do those in the office, though, if they're coming from the cervix, because the cervix has a very good blood supply and you can have a lot of bleeding and can have hemorrhaging really quickly. And a lot of times our offices just aren't equipped to handle hemorrhaging. So definitely, if you have a large cervical fibroid, that probably should be removed in a surgery center or a hospital just because they can bleed very quickly. So now that you know exactly how we remove fibroids, I want you to keep in mind that, a lot of times if I have someone that's done with childbearing, I won't do a myomectomy because there's other things that I'm concerned about as well. So not all the time are fibroids benign. So sometimes you may have a uterine sarcoma, which is actually a cancer. It sometimes may be misdiagnosis of fibroids. So from time to time, if I have someone that's done with their children or I have someone that's older, 50s or up, then I may not do a myomectomy. I may elect to do a hysterectomy. Now, the hysterectomy is the most common treatment for fibroids, in the United States. So that's what we normally do. But for some women that haven't had their babies yet, then I, will definitely do a myomectomy. But keep in mind that if you're older or if you've done with childbearing, hysterectomy may be advised, just because, we don't want to miss a uterine cancer, which is commonly a sarcoma. And even if you have a biopsy of a fibroid and it comes back negative, it still doesn't mean you don't have a sarcoma. It just means that one portion that was biopsy was negative. So unless they remove everything, remove the entire fibroid or remove the entire uterus, we won't know if you have a sarcoma. Sarcomas are very rare, but they do happen. So definitely want you to make sure that you're aware, because most of us, if we see someone, we're kind of thinking about, is this a sarcoma? And one of the tests that we'll get for uterine sarcoma is a pelvic MRI. So a lot of times if I'm going to do surgery for fibroids, I'll get an MRI, not only for treatment planning, but also to make sure there's no characteristics suspicious for a sarcoma, because that's one of the things that I'm very aware of. Well, I hope you found this helpful. Again, if you're interested in this topic, I have several videos that are related to fibroids or abnormal bleeding. And if you want to get my ebook, please check the link below to get another great resource that deals with this topic. And if that sounds good to you, watch this video next. I'll talk to you later, and thank you for watching. Bye-bye.